So what are the work related stress? There can be coping strategy like smoking, alcohol, drug intake, or high risk diets. Now what can happen is, if you have a lot of stress at the work, there will be some way by which you will develop a way to cope with all the stress. So either there will be a drinking or a smoking or any other high risk diet kind of a thing that can indirectly lead to the development of cancer, okay, because of the work stress and the coping mechanism. Now what is the mechanism of chemical carcinogenesis? I already said, okay, the carcinogenic exposure, metabolism, the cell cycle. Either it can cause some problems in the DNA, in the chromosome breakage, which is leads to genomic damage, which can lead to hypermutation, genomic instability, which can lead to cancer. Or there can be non-genotoxic mechanism like inflammation, immune suppression, reactive oxygen species, which can lead to a different signal, like different signal, so that alter signal transduction, so the cell keeps on multiplying and there is a lot of proliferation, there is no apoptosis, and it can lead to cancer formation. Okay, cancer in children. Okay, it's the common cancers in children are like leukemia, acute lymphoblastic leukemias, which is common. Then leukemias and brain tumors account for 61% of the cancer in children from birth to 14 years of age. Most common cancers among adolescent and young adult children are Hodgkin's lymphoma, leukemia, germ cell tumors, CNS tumors, non-Hodgkin lymphomas. What are the causes? It can be multifactorial, like from the fetal stage to the mature stage. Oncogenes and tumor suppressor genes may have been associated with the childhood and adolescent malignancies. There can be chromosomal aberrations or single gene defects, including aneuploidy, amplification, deletion, translocation, and fragility. Wilms tumor and retinoblastomas are the examples of the pediatric malignancies, and they are generally related to familial. So if one child has it, the other child is there is a higher chance that the other child also has it. Childhood exposure to ionizing radiation, drugs, or viruses have been associated with the risk of developing cancer. Around 85% children diagnosed with cancer are cured. Mortality rates have declined because of newer drugs. Young children are more prone to long term sequelae of cancer therapy. So, that's, I think, everything about neoplasia or cancer that we need to know. If there is any doubts or queries, you can ask me in the email, and yeah, it's included in your second midterm, not in your first midterm. So all the best for your first midterm, and thank you.